What's your reason for not getting a colonoscopy? I guarantee I've heard them all. My hope by the end of this speech is to convince you of the importance of getting a colonoscopy. The following information will describe the colonoscope instrument and the components involved with a colonoscopy, alongside with possible risks associated with a colonoscopy. After all, you just might make that decision to schedule an appointment. Tushy, fanny, rump, buns, caboose, keister. No matter what you call it, just have it checked. A colonoscopy is an exam that involves looking at the inside of a large intestine, otherwise known as the colon. So in this slide here, it just kind of depicts on what the large colon and the small intestine also looks like. This is done with the use of a colonoscope, which is a long, flexible, thin, tube-like instrument with a fiber optic multi-directional camera at the end. Let's be honest, it resembles that of a garden hose. The colonoscope has other features such as light, suction, water, air, and a channel for taking samples of tissue or removing polyps. It is approximately 4 feet in length and a half inch in diameter. Next, I have some slides that will show exactly what a real-life colonoscope looks like. And here it shows the dials of the colonoscope which can be used, and also the different ports as I was talking about, the water, the suction, the air, etc. This is the tip that we use for viewing, and that's where the camera is located. The large intestine is a major part of the digestive system and helps your body process waste. This is food that your body can't use. The colon is the biggest part of the large intestine, and it is approximately 5 to 6 feet long. This next slide is going to show you also, again, a little video of a real-life colonoscope.
The camera is located.
Just a tap. Here we go.
This is called a colonoscope, and this is what's used during your colonoscopy. The camera is located on the end here, so we can see what we need to see inside the colon. Don't let this be intimidating. And this is what it is hooked up to, the machine and a computer screen, so we can view it. This is called a colonoscope, and this is what's used.
Okay. I can tell you firsthand, as working in the operating room as a nurse, that colon cancer is not very pretty looking. Imagine a dark red apple starting to get rotten and shriveled skin. A colonoscopy is done to look for changes like swollen, irritated tissues, polyps, or a cancer. According to mayoclinic.org, polyps are described as a small clump of cells that form on the lining of the colon. Most are harmless, but over time, some can develop into cancer, which may be fatal when it's found in later stages. This here are examples of different polyps. These are quite small, and this is the red apple. We don't want to see that. This here depicts, again, the end of the scope, and with an instrument we use called a snare, we can put it around the polyp, snip it off, and send it away to pathology and have it checked out. Signs and symptoms commonly experienced that are suggestive of a colonoscopy are abdomen pain, rectal bleeding, or a change in bowel habits. A colonoscopy is the #1 way to screen for colon cancer. Now, according to the clevelandclinic.org, it's now recommended that the first colonoscopy be done at the age of 45 instead of 50. Of course, if you have other risk factors, such as smoking, being overweight, family history of colon cancer, or personal history of certain kinds of polyps, your doctor may recommend one sooner. And those are examples of those risk factors that I took from hopkinsmedicine.org. A colonoscopy may be done for treatment purposes, such as stent placement or checking for infection. Common excuses I hear for not getting a colonoscopy include, I have no symptoms, I feel just fine, or it's too embarrassing. Good anesthesia or sleeping medicine is used so that you won't feel any discomfort or possibly remember much, just as if you've had too many cervezas. I'd rather be compliant and have a colonoscopy as recommended by my doctor than be ignorant and be buried 6 feet under because of a rather simple procedure to detect colon cancer early on. That's why it's termed screening. Preparation is the most common reason why people refuse to have a colonoscopy, but the biggest reason, I think, is the lack of education. People just aren't well educated on the details of a colonoscopy. Before a colonoscopy, the colon needs to be empty and clean. Any residual may hide any suspicious looking polyps or tissue. A typical prep includes laxatives, plenty of fluids, and a diet modification. Generally, no solid food is to be eaten the day before the procedure, and drinks are limited to clear liquids up until midnight. However, Jell-O and broth and sodas are all examples of what can be consumed. Laxatives can be in a pill or a liquid form. Most importantly, drinking a lot of liquids is best. A clean colon allows for good visualization of the colon. Often I hear complaints about how the prep will affect his or her job and having to take time off, or there's no way I can go that long without eating real food. Typically, only one day of work will be missed, and that's the prep day, in which you will want fast access to the bathroom. Sometimes a colonoscopy can be completed around your working schedule and no time will be missed. A colonoscopy poses a few risk factors from mayoclinic.org. These are rare complications, but I do need to tell you that you could have a reaction to the sleeping med that we used during the exam, or bleeding from an area where a tissue sample or polyp was removed, or a tear in the colon. Rightfully so, people become scared that these possibilities of the procedure can happen. It's uncommon, but it can happen. Lastly, and most recently developed, is an alternative screening tool to aid in the detection of colon cancer. Please know, this does not, and I repeat, does not replace a colonoscopy. A Cologuard test can be done at home with just a sample of stool, and then it's mailed back to your doctor's office. This can detect blood and DNA, but not polyps. This test is mostly used for people that say they just don't have the time to do a colonoscopy. Now keep in mind, most insurances only pay for one screening tool. So either you have a colonoscopy or you do the Cologuard test. Finally, colonoscopies are the most accurate way of detecting colon cancer. However, if your stubbornness is preventing you from biting the bullet, then by all means do the Cologuard. Now you know more about a colonoscopy and the importance of having this done as recommended by your doctor. When you think about the picture as a whole, the purpose behind a colonoscopy, you can better understand and tell yourself that the benefit of having a colonoscopy outweighs the risks. Life is too short. All it takes is one day to get checked. Happy screening.